As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road. Let's camera action, I'm ready to go. I'm never gonna give up.
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everybody. I want to take a little personal privilege. We're going to talk about maternal health now and for future generations. But I guess want to mention that I came to New Haven in 1971 and began working after graduation from the Divinity School with the Urban League. There's been several iterations of the New Haven Urban League and since that time. But in 1975, I worked with a young lady by the name of Pat Thompson. And Pat and I are still young, although we were graduate school student ages in 1975. But Pat managed a program in terms of sexual health and pregnancy prevention. And then we've done two previous shows here on the Tom Ficklin Radio Show on breastfeeding, as well as maternal health from a research standpoint. I mention that because this issue is an issue for me that could be a daily show, a weekly show, so it's not repetitive at all. And as I was joking with some of the folks, or trying to joke with some of the folks on the air that are going to be joining us today in terms of guests, it's a shame and a tragedy and despicable that we are even in 2021 on June 28th, even talking about maternal health. I mean, but I digress. So ladies and gentlemen that are joining us, so you can feel free to be as outspoken as hopefully I've tried to be, but this is an issue that we need to get resolved once and for all, so that Dr. Leslie Sood, who's been involved with this issue for several decades. Leslie, I won't mention the exact number of years, but that information is available if someone wants to pay me to give it to them. But Dr. Sood is assistant professor of clinical pediatrics at Yale School of Medicine for over 26 years in infant and pediatric care. And it's important, Leslie, Dr. Sood, for people to know that. I mean, this is something that we have to kind of get resolved one way or the other. I'm also joined today by Leslie Brown. Leslie is a community health organizer at Clifford Beers. She was formerly at WIC, where she served as a nutrition specialist and a certified lactation consultant. And Leslie has been kind enough to come back for a second interrogation. She was on the show recently. Kim Streeter is with us. I think Kim is going to be joining. Yes, Kim, I don't see your picture, but I see your name, so you're there. And Kim Streeter, I'm not sure, Kim, if you like the Adams part. But there you go. Kim Streeter Adams is a community health ambassador with the Yale New Haven Moms Partnership for about 8 years, and serving as a resource and community support liaison for parents and caregivers in New Haven. And Janet Alfano is with us. Janet is the executive director of the Diaper Bank here in New Haven, well, Diaper Bank of Connecticut, excuse me, and has been with the organization since 2007. He is also a member of the guide team for the Moms Partnership. Seth Poole is with us, and Seth, I'm going to have you introduce yourself because you wear a few hats, but when we get to the why you're on the show and the importance of ink, you can kind of, I want you to take some good moments and describe that critical involvement. Seth is a long-term New Haven resident, a homeowner, entrepreneur, interested in politics, and our paths have crossed a number of times in terms of how to make New Haven a better place. Let's how's everybody doing this morning? Everybody feeling good? You can unmute yourself. Dr. Sood, I want to kind of start with you, and because we hear this term maternal health, but from my standpoint, as I referenced when I worked with the Urban League back in 1975, even the term kind of sometimes I think is an evolving term in terms of what is maternal health in the past, but what is it now as we move forward, and what does it look like for mother and child? And I would dare say, Dr. Sood, if you could throw this in, for even the male component or the other caregiver, the father or the mother or the husband. So it's not just isolated to a sexuality kind of issue. But at any rate, I don't put words in your mouth. But Dr. Sue, welcome. And what is maternal health? What does maternal health look like for the mother, child, and the father or the other caregiver?
Well, thank you. And thank you for having me, and good morning to my colleagues here on this show. You know, I think on the last show on this topic, you had Dr. Reddy present a lot of really fantastic medical information, particular to maternal health. And she referenced concepts and situations that affect health that go beyond the actual medical details and particulars of what defines health. And I think today, you know, this group here is poised to speak about maternal health in terms of not just the mother as a patient and what it takes to care for her from a medical standpoint, but from a mother's health from the perspective of her being a person who lives and thrives in the midst of a community, and that community in a larger society. And so all the things that you just touched on, Tom, like her child and her support system, her partner, the father of her children, her extended family, her extended community, are all woven together in an interconnected web that determines maternal health. And we think of it as a general concept of wellness that goes beyond, you know, what the blood pressure measurement is at one point in time, but all the factors that will determine, you know, what that blood pressure reading might be.
If I could just drill down a little bit more, Dr. Sue, because again, you're a doctor and you've spent several decades, and you know we can ask the tough questions of doctors, and you guys can always say, "Well, in my general opinion, this is what I believe to be the case," and we're still working on additional research. But talk a little bit, if you would, about something called stressors. Are there any early childhood stressors, and how to perhaps prevent that from happening?
I mean, the reason why I'm on this show, to be quite frank, is because all I think about is early childhood stressors. And the work that I've done and the projects that I've tried to integrate into medical care and primary care clinics is oriented towards relieving those stressors. And there's a wide, you know, a tall list of things that we consider stressors, early childhood stressors. Poverty ranks among the leading cause, and I think that we are all agreeing that we can't really discuss poverty without also discussing racism. But poverty doesn't always root from racism, because there's impoverished folks from, you know, all different kinds of backgrounds. But things that a child experiences in their early formative years, like trauma from witnessing domestic violence, or perhaps separation from their parents due to incarceration or engagement in the foster care system, having a parent who experiences depression and isn't able to engage on a continuously, you know, engaged, present level with their child because they're dealing with internal, you know, mental health stressors, or a parent who suffers from or experiences drug use and opioid use disorders. Those are, and of course, then there's the obvious stressors of physical and child abuse, which is a whole nother category.
And I appreciate you sharing that, because sometimes I'm accused, and I'll say accused in a positive way, of folks saying that, Tom, you're always talking about these deep dive issues that are so intractable and insolvable. Well, I say, well, you know, this is just it's my calling. I don't know, maybe I'm a masochist, and maybe I'm trying to impose my masochism on others, but I really feel we got to get the word out. We got to take the deep dive and get the weeds out and decide the degree of whatever the cancer might be. I mean, we hear these terms, stage 4, stage 5, stage 3, this, the other. But yeah, if we're in a disease state, we got to find the cure. So Dr. Sood, I appreciate your clarifying that. Leslie and Janet and Kimberly and Seth, kind of bear with me, because my mind's in a kind of a strange place today about why are we having this discussion on June 28th in 2021. I mean, and even on that note, Kim and Leslie, maybe Leslie B, let's maybe jump in about even what do new moms and parent givers in New Haven need that is not currently accessible. I mean, that might be too much of a macro statement, and I'm not looking for a thesis or your recent TED talk. But Kim, I'll start with you. What do moms need and parent givers need to that's not currently available, or they're not accessing, or just not in their on their radar screen?
I think what moms need is consistent, compassionate, judgment-free care, where medical providers, if they have concerns, they can have an open, honest, caring discussion without making the moms feel shame. The moms need supportive teams, parents and caregivers, and they definitely need help and support provided for them around expressing what their worries and advocating for themselves.
And Leslie Brown?
Yes, thank you. I mean, Kim pretty much hit it on the nail there, hit the nail on the head there. Support, consistent, compassionate support is big. I mean, it's the prenatal period and absolutely the postnatal period is one of the most sensitive and emotional times that a parent is experiencing, you know, and that's the time that one of the times that they would need that most compassion and support, including even if we're speaking specifically about just medical care, having, for example, being able to receive care consecutively along with their child would be a massive burden off their shoulders, because even just completing a postpartum appointment is a really big challenge for a lot of our moms. And it's not their primary concern when you are taking care of a child that you don't really have any support at home to take care, to leave while you go attend to that. Or again, especially as a certified lactation consultant, the thing that comes to my head is when the working and the challenges through learning how to breastfeed. It's those first 2 weeks, the first week that you're home after you deliver your child will pretty much dictate for many moms, whether you will successfully continue to breastfeed and many other factors, because of that necessary, that consistent and compassionate care that should be consistent and readily available. But it's easy to access when you don't have support at home, transportation, a number of other barriers.
Yes. Janet, just before I come to you, Janet Alfano, I wonder, Kim and Leslie, and I'm sure I'm showing my sexism, although I think I'm a reformed sexist, but still, as from a male standpoint, sometimes you're captured in your identity. And so what I'm trying to say is, we hear about this term maternity leave and the lack of it so much, but I think a guy doesn't really. I mean, we can say, yeah, I understand the need for it, but talk about the importance of maternity leave. And my mind goes to our great, and I use the term great specifically, Congressperson Rosa DeLauro, in terms of her passion for this issue. But is there such a thing as the lack of maternity leave? Leslie or Kim, if you'd like to talk about that.
Yes, maternity leave, well, in my experience, maternity leave was not something that many of the moms I offered my nutrition services and breastfeeding consultation services to, that they had available. They would quickly say, I can't do this, I can't breastfeed, or I can't, I don't have time to learn, I don't have time to go to my appointment because I have to get back to work 2 weeks or a week or even less than that after they deliver, which is monstrous to me. You're literally still healing and I mean, it was a lot. I saw moms every day for 7 years, and it was every day, every week, I would hear that consistently.
The lack of time for them to be able to spend specifically with their newborn.
Absolutely, or to heal even, but yes.
Or to heal, that's right. Say that again.
Absolutely, because that's what's happening. You're delivering, a child, not so you're healing from that, but yes, the essential time period that you need for you and your child to thrive post-delivery.
And Kim, I see you shaking your head. Do you want to comment on that?
I totally agree with Leslie. That and, again, the maternal attachment. They don't have the chance to really bond with their baby, as well as new moms' worries about kind of sending your child off to a child care center, because not everyone has a family member that's able to watch a child. So then the moms then have to that extra worry about, oh my gosh, I have this total stranger now watching my kid, because a lot of parents don't have the time to really look into childcare. So, you know, there it's just, to me, it adds on more stress. And then also going back to what Leslie said about breastfeeding, a lot of jobs also don't have that accessible for moms to be able to have a space for them to pump and then store their milk as well.
Mm, mm, mm. Janet, let me bring you in, and again, for our listeners and viewers, if I go from subject to subject or topic to topic, it's because there's so much for us to cover. And as I indicated before, this is not going to be the last show on this topic. And as far as I'm concerned, it's a daily topic in terms of health. I mean, Eve gets the word, the letters EVE. That should tell you that this has been with us for we wouldn't be here if it wasn't for healthy mothers in so many ways. But Janet, even diapers. I mean, a guy might not even think about the impact of diapers and why that's needed, and even the psychological need to, the mental health relationship to having access to diapers. What are the positive ripple effects or positive effects from your standpoint about diapers and the economic implications, and whether they should be free?
Yes, thank you for the opportunity to talk diapers. You know, we know certainly from our experience in almost 17 years of distributing diapers to families in need, that this was an issue. But what we also know, and what was studied through an effort of the Moms Partnership, was that diapers really truly have a significant impact on the mental health of moms. That lack of access to diapers for their babies was one of the highest correlated stressors for moms, that it had a relationship between moms' increased maternal depression. And so we know that lack of access to diapers is not only impacting the health of babies, of young children, in the form of diaper rash or other health complications, but it is also impacting the mental health of moms. And, you know, when you think about that, you know, it was shocking to have that be the most highly correlated stressor over food insecurity or other types of stressors that families face. But if you think about, you know, an ongoing stressor every 2 hours or so, depending on, you know, how often you have to change over the course of several, you know, 3 years or so of a child's life, and then imagine that you're being faced with meeting that over that course of time. Of course, that, you know, that makes sense, that that is a stressor. And so what we know is that it's truly important to make sure that families have access to diapers for the physical health of baby, physical and mental health of mom, and also the economic health and well-being of the family. That providing these items allows for families to bring their child to childcare because that supply is required, and creating more economic opportunities for that family because they can drop that child off at childcare and attend work or attend school more consistently.
And Jen, if I can just follow up a little bit, because just as you were speaking, I was listening from what you mentioned is just a current reality, but then when my mind went to the impact of COVID and whether that has exacerbated, and again, we're not out of COVID either. I mean, in spite of every effort that we're making. So I was just curious, from your standpoint, did COVID highlight, exacerbate, draw more attention? What are your thoughts in that regard?
Yes. Yep. So I think it did all of those things. Certainly it put a spotlight on, you know, access to basic needs, basic, very personal needs. You know, we saw the issue with toilet paper not being on the shelves, and families also experienced, you know, supply side issues with getting diapers. And so it's shown a spotlight on what we know families are already experiencing because the supply side created this issue for the broader community. But we knew that this was an emergency, certainly for the families, for many, many families around the state, and that these kinds of sort of sudden economic events or shocks really worsen diaper need and mental health, you know, having a direct impact on the health and well-being of a child and a family. Obviously, all of the stressors that occurred because of COVID were most focused on families that were already experiencing economic hardships, and all those structural things like low paying wages and inconsistent scheduling. Like, those were the kinds of folks who were most impacted by all of those economic realities that COVID brought to those across our state.
And Dr. Sood and Seth, and I'll come to you in a second, but Janet, I guess wanted to kind of ask you again, is it fair to ask you about, because I majored in political science and I went to Bucknell University, and although I did hold a small political office, but the economic policies, national policy, local policy is always kind of, I try to pay attention to it. So we've heard the term baby bonds. Is it fair to ask you a question about baby bonds? I mean, again, because I really think we got to give people incentives and well, at any rate, baby bonds, what's that all about?
Sure. So I can just share a little bit of information at the state policy level at what Connecticut did, which was really wonderful and exciting. The state treasurer, Sean Wooden, really talked about this idea of baby bonds, and it's an initiative that was passed through the state of Connecticut, and it looked at creating a savings account for every Connecticut resident that was born on or after, so it'll be January of 2022, whose birth is covered by Medicaid, so targeting those young children most low income, in order to narrow the racial wealth gap and improve economic outcomes directly by investing in the children, by creating a savings account, in essence, that can be used for a couple of things, one of which is education, so college education, home ownership, and also business creation. And so, I was so happy to see that it, and it, it's a wonderful win for the state in just one more tool to help families by providing these savings accounts with finances that are going directly to the family.
And thank you so much. I think Dr. Sood, you wanted to comment or elaborate on that?
Well, I wanted to just, if I can, intervene or inject just a point of science around the discussion of stress.
We got to follow the science because we got to.
What we've come to realize recently when we're talking about stress, you might on the face of it say, okay, it's stress, so what? Well, the so what is that it turns out that exposure to stress, especially in young children with that rapidly growing brain, causes inflammation in our bodies. And that inflammation actually causes changes in our DNA that can affect our health as adults. So when we experience stress early in childhood, we might have higher rates of certain types of cancer or heart disease because of the changes on the body that resulted from that early stress and the inflammation it caused. And what's even more concerning is that those stressors or those changes, those genetic changes, are now shown to be passed from generation to generation. So I wanted to just kind of tie that into why we as physicians and clinicians and anybody who supports health care so much about stress. As far as the baby bonds, that's one of a suite of economic capability opportunities that I think are becoming increasingly available if folks know about them and know how to access them. And insofar as we talked about poverty being one of those early stressors, this is a policy-wide intervention or a state level intervention that addresses that in a systematic way. And it's wonderful. Other interventions similar to that is the Earned Income Tax Credit, the child tax credits that we're hearing about with the American Rescue Plan. And then in New Haven, I don't know if you've ever had a show that chats with the folks at the New Haven Financial Empowerment Center.
I have not, but I will call them up, and I appreciate the tip.
I'll hook you up.
Hook me up. Give me
I will hook you up. Yeah. Whose sole mission is to end poverty in Connecticut as we know it by providing a suite of free financial coaching and savings products for New Haven residents.
Excellent, excellent. Dr. Stu, when you mentioned the shows that I've had, whenever I do a show, I try to do a little bit of a just deep dive and review what I've said before or had a chance, people I've had a chance to talk to, and also it's a way to kind of fight, I would say 30-second Alzheimer's. I don't think I have Alzheimer's yet, but just to kind of keep the mind working. Make a long story short, I did do a show on doulas about 2 or 3 years ago. Is that still something that's relevant, or anyone can kind of comment on that, or makes sense, or is that is there stock hot, or is it just, how significant is the doula care? Dr.
Doulas are around. I mean, I was just jumped in. They're absolutely around. We have a lot of different support programs and services that are available. But someone might correct me if I'm wrong here, but I think many of them, run on grant programs and grant money. We don't have a truly well-organized way to compensate and fund these services. And which is something that we might touch on later during this topic. But doulas are fantastic because they're another way of bringing supportive, stress relieving interventions into families' homes and supporting the pregnancy, the birth, and the aftercare of mom and baby.
Excellent. And Kim, what's burning on your heart as you hear this? Because again, you've been on the ground, not to say that we all haven't been on the ground and face to face with these issues, either from the textbooks, from the library, from the lab, just talking to people. So the beauty of this conversation and the various guests are that everyone's been committed. I mean, Seth has been committed. I mean, you have what, two children, Seth? So he's been a part of this problem, I think, or adding to the population growth. And so, but Kim, what goes through your mind as what you've heard thus far in terms of your experience, and where do you want to go from here? Just unmute yourself, Kim.
Me, what comes to mind is just making sure that we give the moms the proper maternity care that they need. Oftentimes you hear stories about moms being shamed at the doctor's office and, afraid to kind of ask those questions that they need to ask. But they, sometimes mom thinks that, oh my gosh, maybe I shouldn't say this, or, is it okay for me to breastfeed at this time? It's just, for me, kind of being in the community and hearing what moms are saying, coming from doctor's appointments, moms sitting in the doctor's office all day waiting to be seen, with their children waiting to be seen. Those are problems. And they should have the same treatment for all moms across the sites. And given the knowledge of the providers within their coverage prior to them giving birth. And that's not currently happening for moms.
Mm-hmm. Let's go to, again, I'm in this mindset today of just trying, at least constructing the hard questions and not hanging everybody by the thumbs if you don't come up with a solution in the next 20 minutes to the question. But what's getting in the way of having families' needs being met? I mean, Kim, you kind of alluded to that. And then funding services. How important is the economic reality in terms of, are funding services creating barriers or eliminating barriers for families obtaining care? And Seth, I want you to kind of weigh in. I want to maybe ask everybody to kind of share that comment, because we have a good 20 minutes or so remaining. Really take the deep dive about structural issues, generational pass-through issues. I mean, Dr. Stu, when you referenced behaviors being perhaps passed on from generation to generation, we have people that have been committed to making this world a better place, and dare I say, people committed to not maybe making this world such a better place. So that this is a conundrum that I think is really important for us to discuss in terms of Eve, E-V-E. I mean, who was the first mother and future mother? So without being too metaphorical, who wants to take a bite of that apple, since I'm using the Eve metaphor, maybe too much in terms of structures and what's keeping, what's standing in the way, what barriers are being erected, what infrastructure do we need to maybe remove and to implement in terms of services and family and maternal health.
I'll jump in maybe real quick.
Janet, jump in, take the deep dive,
Okay.
and pave the way for everybody else to kind
Great.
of comment on that.
I'll do my best.
Do your best.
I think, leading a nonprofit, one of the things that I see in trying to construct our budget to provide a basic need for families, right? There's no dedicated funding for diapers. There isn't a diaper benefit. So we, as a small nonprofit, have to sort of, MacGyver together, create this budget that will support families from a lot of different sources, grade and blend different funding on our own. And what ends up happening is that doesn't necessarily happen in the at the higher levels of government. So federal agencies and state agencies each have their pots of money, and you could essentially be funded by a lot of different areas, and then have different reporting requirements back. So it makes it really complicated. And imagine a family is essentially doing the same thing in trying to create a family budget with different, maybe fewer revenue sources, and figuring out how are they going to pay for these very basic essentials. And so I think, streamlining that process, and certainly efforts like this integrated care and this model through Clifford Beers is a way to bring all these folks together to create really what can be better care for families overall by thinking about those payment structures.
Excellent. And Seth, let me bring you in on that note, and I'd appreciate Dr. Sood and Leslie and Kimberly's comment, because the Inc. is something I've been involved with, something called Empower New Haven for 7 years. I was here in New Haven for 10 years. If you walk down the street today and ask 100 people, have you ever heard the word Empower New Haven? I think maybe 10 might say yes, although the total 10-year existence of the program invested over $20 million into New Haven. So I say that to say that sometimes we're not sure how we get the appropriate return on our investment. But Seth, take the lead in terms of Inc. and embrace New Haven and your role. And I really want to thank you for holding your son. What's your son's first name?
Zachary. Thank you so much, Tom.
To give Zachary that visual metaphor for that is where he is the reason, and his primal scream right there. I mean, again, we want to make sure that's his voice. His voice has to be heard.
Yes, his voice does have to be heard, and I think that it's ever so appropriate that right now, like, what are the barriers about my reality right now? Real time has to be working. She has the benefit of having a husband who's available to assist in the child in child care, and we have the adverse blessing of being indoors during the pandemic to help rear our children and care for one another. To list another one of those barriers for postpartum individuals, given the prevalence of cesarean section birth, that's like big time surgery. And you need to heal from big time surgery. You go to work 2 weeks if it takes you 6 to heal. It's illogical. Pain. And it's like, how do we actively support parents who have newer and younger children, increase access, center the needs of the entire family. So my role is Director of System Care with Embrace New Haven Inc. Manage our team of community health organizers, which is stellar, Miss Leslie Brown, as a lactation consultant and years of working with WIC. Firsthand, what Janet as well, sharing the angst with which parents show up because they're lacking finding poverty, multi, it also be part of a mind. Well, like if we go up in poverty to Dr. Seuss, that we inherit, you know, is it truly creating a box around really ability whatsoever for to see a silver line? That's the work that we are doing. It's connecting the best practice, state level to the local level, engaging young people well to create a more healthy environment in which our grow, learn, partnership count, governing body and collective partnership of state level providers. Doctors are on the partnership. Well, discuss a great deal what it is are the barriers, how do we collectively get over and through practices. Think to pivot and be creative and really respond to our community is very unique. Tip my hat for effort. Community health van, pandemic services, driving these are the levels of engagement required. Main real provide healthcare. Postpartum individual. Take a page out of your book, Tom. Ultimately,
you can take the whole book. I even sell it to you for a good price.
Promoting and investing in maternal sex. Or that was something that on an earlier show, because when you talk about mental health, it's ambiguous. Maybe that pre-existing. It was like when you say success, self to the strengths of the community, focusing, but through havenness, their families and their strengths build upon, so they are self-sufficient, self-advocates, which not require into because they privacy.
We have another 12 or so minutes. Let's drill down in terms of the success dimension and the success connotation. I mean, does that mean alternative payments? Does that mean what structural revisions? Does it mean lobbying more? I want to kind of throw it open to everybody. But from a solution and a solution / visionary / tactics / strategy standpoint, what are we doing now to kind of increase that success, not just incrementally, but to increase the success exponentially? I'll throw that open to the very easy question to you, Dr. Sood, first, and then I'll have Janet respond.
There's so much I want to talk about.
Leslie. Well, that's why we've done 2 or 3 shows, and that's why I said before, this is a daily show. This is a daily show, so jump in. Well, please.
I wanted to just pick up on, and thank you so much, Seth, for those kind words, and just sort of touch on the mobile health program that I started really in response to the pandemic. It started out as a simple, moms and babies need these postpartum clinical visits, and we have a pandemic, and we were back in March of 2020 being told to stay home and don't stand closer to 6 feet from somebody and wear a mask and all these things. And I was looking at the moms and babies coming into our clinic back in late March, early April, coming out of Ubers and getting off of buses and thinking, what are we doing? So we started this mobile health program with the community health care van to get the care out into the community to save families the community exposure to coronavirus. But very quickly, it became about something else. It became what Kim was talking about, mothers in pain, and Seth, mothers recovering from C-sections, appreciating and benefiting from care that's delivered to their doorsteps rather than asking them to trudge their way into clinics, arranging childcare for other siblings, for having people taking days, their partners taking time off from work and suffering economically because they need this visit. And the fact that we were scheduling the mom visit and the baby visits on separate days, which is a practice we still do. So what we've been doing is coordinating these visits with mom and baby dyads and providing that care, together. But the barrier, back to the point of barrier, is that it's an expensive delivery model in our current payment systems. Clinical institutions don't love this program because it diverts patient numbers, and reimbursement metrics away from their accounting systems. And so for alternative payment models, yes, I think there's a very critical and needed opportunity to revise and reinvent and redesign payments so that we can expand these services and make them meaningful and impactful.
And Janet, Leslie, and Kim, just before I come to you, I want to just go back to you, Seth, and see if I'm understanding correctly that Dr. Sood is suggesting that what is Inc.'s role in terms of this economic realignment, this economic payment realignment? Because folks when they hear the term community health worker, we know that there's a plethora of organizations in New Haven. We can always debate which organizations are successful or not. But I think sometimes we lose, and we talked about baby bonds, et cetera, but is Inc. involved with this economic transfer of funds and dare I say community benefit and the return on the investment? So how is CARE, Clifford Beers and Inc. and Embrace New Haven involved with this realignment of economic investment?
Thank you for the question, Tom. We are the driver of that. The Embrace New Haven initiative is one of two out of the total 8 awards received that's taken on the responsibility of addressing infant immigration. Here in New Haven, we see it as a main need, given the years of dedication and work that Haven Healthy Start, improving the disparities in healthcare. Ultimately, down to the alternative payment model. Our particular model is geared toward improving outcomes for postpartum individuals after birth, and because we're actively working to form how methodology, thinking creatively about how care coordination, that direct point of contact. So care coordination, to your point, community health worker model, that person connected to the family by their own design, by their own choice, and how that person is services compensated to regularly available and the family. And that's what we're working with directly with SS as a partner, state level, and that's where we kind of left off, because years ago, specific about very similar behavioral care approach to drawing upon the where it disconnected.
Indeed.
So here, this iteration bring us to the peak and actually see so much of the work to the point sustainable.
Excellent. Excellent. We have about another 10 minutes. So let's take 2 minutes each. And Leslie, let me jump in with you because I could see you're expressing the body language that everything that you've heard so far has been let's say reinforcing, but I don't want to put words in your mouth, but just respond about what you heard so far for the last 45 minutes. And where do we go from here, and your role, and also everybody going to ask you, what do you need? If we looked at a global not global, but if we looked at the massive organizational chart in terms of the Partnership Council and Inc. and Clifford Beers, sometimes I think we just look at our own organizational charts and not a macro organizational chart. So everybody needs. I mean, Alice Forrester needs help, right? I mean, President Biden needs help. But Leslie, what have you heard thus far, and where do we go from here in terms of your role, and what would you like to see? And that's kind of the same question I'm going to ask everybody. And take a minute and a half with part of your closing remark.
Thank you again, Tom. Really, I'd like to see just more action on these conversations, like Dr. Sood has with that fan. Like we're trying to do with the system. This has been, ongoing for a long time, and so addressing it is a fantastic step, having these conversations, but also seeing, more and more organizations and legislature and government just act on it as well and continue to put that forth. I mean, really what it comes down to is, of course, access and support, as mentioned before, but also continuity in that care. That is essential. So creating systems where, all providers are literally working together as a team without silos, not worrying about what organization is where and who's with whom. What does this mom need? Are we all in agreement? Let's work together as a team. And that is really what's going to get all of our moms the care that they need. That continuity in care and teamwork and elimination of silos with an understanding of the need for support, compassion, and equitable services.
Excellent. Kim?
I have to agree with Leslie, as well as, from what I know about Inc., just having that care kind of be like that one stop is going to be critical for families in the community. I'm usually in the Stop and Shop hub that we have on Whaley Avenue. So having moms come in and ask about just resources for food, for diapers, and just like medical, or even to sign up for preschool. So to have a one stop where I'm not giving a mom like 50 numbers and telling her, okay, call this one first, and then, they'll transfer you here. But to have those resources accessible right in the community is going to be really critical going forward and actually making it happen.
Excellent. Janet.
Thank you. I would add, the great thing about being a part of this work and having the leadership of Clifford Beers and all these folks around the table is that there's real leadership and a real desire and want to change and be a part of it. And at the organizational level, having folks here who can say, this is important. We can also advocate for some of these issues at the higher levels. And we can also change our own practices. We can say, I'm going to choose to do something differently because of this collective work. And that is something that I think will really help move this forward, is that those levels, all of those levels, the advocacy, to the broader community and the legislature, but your own internal organizations, you can change the practice to be aligned with this work.
And Dr. Sood, just before I come to you, how important is it, as I see Seth holding his son there, for the young man, the young child to have that close connection to the heartbeat, to hear, how important is it to hear Seth's voice? I mean, Seth was not talking, he was not saying lullabies to the son, but I think is it fair to say, just hearing, for the young people to hear, young person to hear his father's voice, his or her father's voice, that's soothing. Am I totally off track, or am I?
No, you're right on the money there. I was actually having the same observation here while the others are talking. I was just gazing at that little boy who fussed and squirmed a little bit, and then there on his dad's shoulder, he found a place of comfort and he eased off into a restful sleep. And kudos to you, Seth. You didn't put in front of a screen in order to distract him, you held him close. And we're trying to promote a lot of that, more of that attachment and bonding that was referred to earlier through our home visiting programs and breastfeeding support and better postpartum policies and high quality daycare that creates these opportunities.
Well, let me kind of, we have four more minutes, and I'm going to pose this question. It's kind of off script, and hopefully you won't be offended by my asking, but I want to go around really quickly. And we mentioned stressors. What's keeping you somewhat balanced or focused or committed? And I say you, everyone, in spite of these stressful times. Are we over exaggerating the stressful times? I mean, certainly caveman, cavewoman times were stressful. I guess any time on the planet has been stressful. But it seems to me,
I'm going to take that. It's all very selfish for me.
And this is for everyone. So go ahead, please.
This is selfish for me. I need the young people who are being born now and being raised now to take care of me and my generation when I'm older. So I need them to flourish, and I need them to thrive, and I need them to be prepared to solve the world's crises and problems, such as climate change and wars, and you go down the list.
Excellent. Janet?
I'm hopeful because of a lot of the work that's being done, and it feels like there's true momentum in trying to really structurally address a lot of these issues. And so I'm hopeful that while there are a lot of stressors, and this does feel like really a stressful time, I'm motivated and inspired by the work that's going on.
Excellent, excellent. Kim?
This is my passion.
All right, there, go ahead.
I love talking to youth in the community, even though like talking to the youth is not a part of my job. So it's just a passion that I have. You know, this is the community I grew up in. So just being there, as someone was there to support me, just being there to support the community and the families that are here is critical for me. And it makes my heart feel good. So.
Leslie Brown, just before I come to you, Kim, if I can just follow up, and this is not to put you on the spot, but you're aware of that some of the young people are been reluctant to get vaccinated. What do you say to them? How do you feel about that? This is not necessarily particular to our script, but in a way, if it is particular to our script, that the young people are going to be mothers and fathers, and if they're not, well, at any rate, what's your feeling about the hesitancy among the younger generation vis-a-vis vaccination?
I think that there's just not enough knowledge that they have on the vaccine. And for me, anybody I run into, I'm like, well, have you been vaccinated? Well, are you going to get vaccinated? You know, and just kind of giving them a little bit of knowledge on it, because my own children have been vaccinated and they realize the importance of it. So just kind of like just trying to keep that importance and kind of like push aside the myths. Because so many people are scared of vaccinations when they don't realize you've already had other vaccines. So there's, you know, safety in getting the vaccine as well. So,
and Leslie?
Pushing it.
Well, I believe we're still referencing my drive for motivation.
And if that question still resonates with you, you can throw out another question. I believe in a free society thus far. I mean, it's free as a relative term, but the question is, as where is the spirit moving you at this particular moment at 11:54 on Monday, June 28th?
I mean, I am here, and I'm still here, and I will be here really because of I have, you know, I want my kids to be able to not have to talk to somebody about what many other moms talked to me about when I was seeing them, to not experience a lot of what I've heard and witnessed and experienced myself. I want them to be happy, healthy, safe, and as Dr. Sood said, have the tools and the resources and the support they need to conquer all the challenges that are already present and will continue to be. So and that starts in the womb with support to that womb and to the wonderful being and mother and parent carrying that baby and nourishing them. Attachment is huge, and the need to be able to build a secure attachment, which comes from having that support prenatally and postpartum, not just 6 months or 6 weeks, but even up to 12 months and after, is essential. And this work is essential. So it starts from the beginning. I think if we want to solve any problems, this is it.
Excellent, excellent. And Harry, our station manager for WNHH, will play the music, so that will be kicking us off. But I'd like to kind of press it to maximize every second we have on the air. And so Leslie, as a follow-up, what keeps you engaged and passionate? Too late. I tried, guys. Next time, Leslie. Next time we'll get you. Janet, thank you. Dr. Sue, thank you. Seth, thank you. Seth, and Kimberly, thank you as well.
HLP 103.5 FM, New Haven.
The source from which all things come. Security blanket for the stars. Understand what Black